the managed care system, as I said before, also known as the medical care plans. The purpose of a medical care plan, and I encourage any business to get involved with this, whether it's through a conglomerate business outfit or as an individual company. The purpose is to allow the employer to choose the doctor who will treat the injured workers. Simply stated, that's the basic purpose. The premise of the question is that doctors seem to tend to favor claimants. And that may be true for authorized treating physicians. And what you can do in a managed care plan is to designate, and you have to designate at least 5 doctors in every discipline in the plan to the system to allow the injured workers to have a choice of physicians. So there has to be at least 5 per discipline. So if it's an orthopedic knee doctor, there has to be 5 orthopedic knee doctors, and so on and so on and so on. But you're allowed to choose your own physicians, and the injured worker has to go to one of those 5 doctors, period. So if you're searching for doctors who have a reputation of being a little bit more respondent friendly or employer friendly, that's the way you do it. You get yourself involved in it. How do you get to participate in that program? You have to you have to apply for it, obviously. It's subject to approval of the chairman of the Workers' Compensation Commission. Those of you who may know, John Master-Petro is the chairman of our commission currently, although he's close to retirement, so who knows who will follow him. It takes about 120 days to undergo the process where the chairman's office reviews your application to participate in the program under the statute. The plan is reviewed every 2 years thereafter to make sure that you're in compliance with the statute regarding the program. There are certain financial and reporting requirements. I'm not going to bore you to tears with those. Okay, what's in the plan? What's the plan all about? It applies to injuries that occur on or after the date of the approval by the chairman. So there's no grandfather clause. You can't, someone who's injured 2 years ago, put them in the managed care plan. It only applies to the date of the approval moving forward, and it's a date of injury rule. Okay. You must allocate at least 2 emergency rooms. So if you have a company here in Naugatuck or a company here in Waterbury, you can choose St. Mary's and or Waterbury Hospital if you like, but there has to be 2 ERs involved. The list of providers or the doctors, it has to be updated quarterly, because you might not be too happy with some doctors and they seem to be more claimant leaning, and you can put in another physician that you think may be more respondent friendly. There has to be at least 1 occupational health center, as I said before, Concentra or St. Raphael's, or it used to be St. Raphael's, now it's Yale. Everything's Yale. So Yale Occupational Health is one example. And the claimants have the right to ask for a second opinion. They can come before the commissioner for that. All right, now this is what it's really all about. The purpose for my statement this morning regarding the managed medical care plans is this: does it save you money? And the answer is absolutely yes. Not only based on your ability to choose doctors, but it's also kind of cuts the legs off of the workers' compensation system. And I'll be honest with you, it does. So what happens when someone gets injured at your work and you're under our managed care system? What happens is that the person goes to a doctor and seeks medical care. Under the plan, you have the right to review the medical treatment that's being requested by what normally is what we call a nurse case manager. So if someone wants to get physical therapy or some complex new surgical process, a nurse case manager will review the application. They have so many days to respond to the request from a doctor. So if Dr. X wants to do XYZ procedure, the nurse case manager will review it, determine whether or not it's appropriate under whatever protocols they use in the system. And if they deny the request for the medical treatment, the injured worker has 15 days to appeal, or they lose their right to appeal. It's black and white. 15 days to appeal. And what normally happens is that the doctor assigned to the case, the treating physician, will actually send in the appeal. They can appear at the appeal in person, or they can just send it in through writing. The appeal is a second line defense for employers, and that is normally the chief executive officer of the managed care plan, or up to a 3-doctor panel actually reviews the request, and they come to their determination. Okay, And then if the determination is in favor of the respondent or the employer in that case, that's when I get involved. So a lot has to happen before the case gets to the Workers' Compensation Commission. And at that point in time, any injured worker can appeal as a last-ditch effort to get the care that they're seeking. That costs a lot of money. For example, the most recent thing that's costing so much money that you may or may not know about is these hybrid pain creams that cost upwards of $1,400 per 2 ounces. So that's an example of something that can be denied through utilization review and through the managed care plan. So the third line of defense is me. Okay, so you can come before me and ask to have that treatment authorized. And what the statute says is that I can only order that the treatment be given if I feel that the first 2 steps in the process were either unreasonable, arbitrary, or capricious, which are very difficult standards to overcome. Because so long as the doctor or the nurse case manager justifies their denial of the medical treatment, then there's no way I can overturn it. It has to be arbitrary, unreasonable, or capricious, and those sound pretty difficult to overcome. So that's how the medical care plans work.